You're bleeding. Not the kind you fix with a bandage and a reassuring smile from your mother. The kind that pools. The kind that narrows your vision into a tunnel and turns your legs into unreliable ideas. There's a hole in you that didn't exist 10 minutes ago, and the closest hospital is either a pile of rubble filled with people who'd happily finish the job, or 300 miles away through territory that wants you dead. No ambulance is coming, no surgeon and clean scrubs, no morphine drip, just you, a bathroom cabinet, and the very real chance you're about to become compost. But here's the truth about bullet wounds. They're brutally fair. Prepper, scavenger, or innocent bystander, it doesn't matter. Human bodies leak the same way. And if you know what you're doing, if you can keep your hands steady and your fear on a short leash, you might just seal that leak long enough to see another sunrise. Relax. We're doing field medicine, apocalypse edition. Step 1, stop the bleeding before you turn into a statistic. First priority, pressure. Not the philosophical kind, you've got plenty of that already. Physical pressure. Grab the cleanest cloth-like thing within arm's reach. A t-shirt, a towel, a curtain, a sock, if that's all life gives you. Fold it into a thick pad and press it straight onto the wound like you're smothering a small fire, because that's exactly what you're doing, choking a hemorrhage before it empties you like a punctured balloon. Press hard. Do not look. Do not lift it to check. Yes, it's still bleeding. You have a hole. If the fabric soaks through, don't pull it away. Add another layer on top. Peeling it off rips away the clot you're begging your body to make, and suddenly you're back at the beginning. Only now you're dizzier and the room is spinning like a busted carnival ride. If the wound is on an arm or a leg, raise it above your heart. Gravity is free and surprisingly loyal. If it's in your torso, forget it. You can't float your organs. Just keep pressing. Step 2, the tourniquet, when pressure alone isn't enough. If the bleeding is arterial, bright red, pulsing, spraying like a blown radiator hose, you need a tourniquet now. Find something about 2 inches wide, a belt, a strip of denim, a leash, not a shoelace, not wire. Those slice tissue like a cheese cutter and guarantee you lose the limb. Wrap it around the limb a few inches above the wound, between the hole and the heart. Tie it tight. Then grab something rigid, a stick, a pen, a screwdriver, and twist it like you're winding time itself. Tighter, still tighter, until the bleeding stops. It will hurt a lot. That's how you know it's working. Mark the time somewhere obvious. Ink on skin, blood on the wall, whatever you've got. Leave a tourniquet on too long and the limb dies. You have maybe 2 hours before tissue starts giving up. After that, you're choosing between bleeding out and losing an arm. Good choices are rare these days. Step 3, clean the wound or roll out the welcome mat for infection. If you're still alive, congratulations. Now you stop sepsis from finishing with the bullet started. You need to irrigate the wound, meaning flush out dirt, fabric, and every unwanted passenger that came along for the ride. Boil water if possible. Let it cool until it won't cook you from the inside. No stove? Use bottled water. No bottle? Tap water beats nothing, even if it tastes like rust and bad decisions. Pour it straight into the wound. Not a trickle, a steady stream. You're washing debris out, not blessing it. Saline works best if you have it. Hydrogen peroxide can be used once to foam out the grime, but don't get enthusiastic. It damages healthy tissue. If you've got vodka or whiskey, save it. It burns, it doesn't sterilize like you hope, and you're going to want it more for your nerves later. Pat the area dry with the cleanest cloth available. Let's be honest, nothing is truly clean anymore. Step 4, pack the wound, because holes don't close out of kindness. If the bullet passed straight through, you've got 2 problems. If it didn't, you've got 1 hole and a piece of metal playing hide and seek inside you. Either way, pack it. Find sterile gauze. If not, clean gauze. If not that,
the cleanest fabric you can find. Tear it into strips if needed. Start at the deepest part of the wound. Gently but firmly push the material in with your fingers or tweezers. Don't shove it all in at once. Layer it. Think of stuffing a very small, deeply upsetting turkey. The goal is simple. Fill the cavity to create internal pressure. You're stopping bleeding you can't even see. There's a balance here. Too tight and you kill circulation. Too loose and it does nothing. You want firm but forgiving, like a weak handshake from someone pretending to care. If there's an exit wound, repeat the process there too. Once both are packed, cover them with a larger dressing and secure it. Medical tape is ideal. Duct tape works when reality doesn't care. Scotch tape is a bad joke, but if it's all you've got, layer it like your life depends on it, because it does. Keep moving. Step 5, antibiotics, the line between survival and slow death. Infection is the quiet killer that shows up after the chaos. A bullet might miss your heart. Bacteria doesn't respect luck. If you have antibiotics, amoxicillin, doxycycline, anything broad spectrum, start them immediately. Follow the dosage. Do not skip a day because you feel fine. Feeling fine is the lie your body tells before it collapses. No antibiotics? Stay calm. Find honey, real honey, not corn syrup in a novelty bottle. It has natural antimicrobial power. Spread it on the wound before dressing it. It sounds medieval, but science and desperation agree on this one. Garlic works too. Crush it, mix it with a little oil, and apply it to the gauze. You'll smell like a bad restaurant, but you might avoid dying from infection. Everything out here is a trade. Step 6, watch for shock. Your body is dramatic, and shock is its worst performance. It kills more people than the injury itself. Look for pale skin, rapid pulse, shallow breathing, confusion, cold sweats. Here's the cruel part. If you're checking yourself and realize you're confused, that's a very bad sign. If it hits, lie down. Raise your legs if you can. Get warm. Blankets, coats, anything. Sip water. Don't gulp it. Your stomach is not interested in processing a flood right now. So why does any of this work? Because your body is already fighting for you. Blood clots are platelets stacking together like microscopic sandbags. Pressure helps them build faster and hold the line. A tourniquet simply cuts off the supply upstream. It buys time. It doesn't fix anything. Packing the wound creates internal pressure and gives tissue something to rebuild around. Antibiotics, or honey, are your strike team, clearing invaders before they dig in. Your immune system handles the rest. Survive the first hour and your chances double. Make it through the first day and you might actually live. And that's the point. There's no hospital, no doctor, just you, improvised tools, and a stubborn refusal to die on a filthy floor. Look at you. The wound is packed, the bleeding is stopped, you're still breathing. Out here, that counts as victory. If the pain fades and the fever never comes, congratulations, you made it. If the wound turns red, swells, and starts to smell like the end, at least you fought. And in this world, fighting matters. Now, get moving. There's a bullet to deal with later, or a grave to stay out of. Either way, you're not finished yet.